Welcome to another episode of our podcast. Today we have a truly special guest with us, Dr. Phillip Ovadia, a renowned heart surgeon and author of the groundbreaking book, Stay Off My Operating Table. Now, you may be wondering, why is a heart surgeon telling us to stay off his operating table? Well, that's because heart disease rates are higher than ever, and Dr. Ovadia believes that the key to tackling the epidemic lies in improving our metabolic health. In fact, in his book that I've just finished, he mentions a staggering statistic that reveals that 7 of the top 11 causes of death in 2020 were related to metabolic health. Those include things like heart disease, cancer, stroke, diabetes. But here's a twist. Dr. Ovadia argues that the current medical system, with its misaligned interests, outdated nutritional guidelines, this is what's actually contributing to the problem. That's right, folks. The system is wrong, and Dr. Ovadia is here to set the record straight. So buckle up with me and let's get ready for a fun and engaging conversation. It's going to challenge your beliefs about health, nutrition, and the medical industry. Together, we're going to explore the principles of metabolic health found in Stay Off My Operating Table, debunk some of the common myths, and learn how to take control of our well-being. Trust me, you don't want to miss this eye-opening episode with the one and only Dr. Phillip Ovadia.
Thank you for that introduction, James. Great to be here with you and really excited to have this conversation with you and your audience today.
As am I, Doc, and I really wanted to dive into this because of my own personal experience watching people. I've got people in my life that are on the way to the operating table. I've had people that have been on the operating table, the heart doctor's operating table, the heart surgeon. And I want to find ways to contribute. I don't know other ways to do that than to talk to the people that are pointing out these misaligned interests, especially with nutrition and these regulatory bodies that are captured. So I'll just dive right in. So despite the advances that we've seen over the last 30 years in medicine, heart disease rates they're surging globally. So why is this silent epidemic seeing such a frightening momentum in this spike upwards?
That's a great question that we should be asking more, James. To set the table properly, understand that heart disease has been the number one killer here in the United States every year for the past 50 years. And it really doesn't show any signs of slowing down. And in fact, over the past 10 years, the rates of heart disease have been accelerating again. And we see this mirrored worldwide as well. Heart disease is the number one killer worldwide. We declared a war on heart disease here in the United States back in the 1950s. In 1955, President Eisenhower, while in office, had a heart attack. And this appropriately set off the alarm bells because you didn't have to go back very far. When you go back to 1900, heart disease was rare. We have reports from the leading physicians of the late 1800s, early 1900s, and they would go their entire careers without seeing cases of heart disease. And by the mid-1950s, heart disease is skyrocketing. We declare war and say we're going to fix heart disease. And here we are 70 years later, and heart disease is still the number one killer in the U.S. And we'll get into it, but I think a large part of why that is because causing heart disease. And we've become so busy treating heart disease that we've stopped thinking about why it's occurring in the first place. It really, has become so ubiquitous that we now consider it to be normal. Mm-hmm. But, it obviously isn't, because it wasn't very present just over 100 years ago. So the question of why heart disease is so present and what we should be doing to stop it, I think is a big question that we should be asking, because quite frankly, while we have gotten better at treating it and we can keep people with heart disease alive longer, we're being overwhelmed by the amount of sick people in this country, and we need to change that. We need to figure out how to make less sick people rather than, how to maximize their care and how to keep up with their care.
It's part of it is cultural influences, like you said, with normalizing just a state of sickness, right? Growing up, I thought that, you just got sick as you got older. And as people got older, more and more medications. And so if we were to unravel some of the conventional wisdom on heart health, could you dissect how you were trained and how that intersects with AHA's guidelines concerning cholesterol management and statin use? And is there a shift in the paradigm towards metabolic health in the broader cardiovascular occupation?
Yeah, sure thing. So, the first thing to recognize about how I was trained and about how all the physicians in this country are trained really is that it was, like I said, being sick was normalized. Heart disease was normalized. The focus of the healthcare system here in the US, and again, really true for the most part worldwide, is on taking care of sick people. So we were trained to figure out, what disease people had and then how to treat it. And that treatment is usually going to be based on medications, surgeries, procedures. We weren't really trained to think about why they might have gotten that disease in the first place, and to think about the root causes of medicine, of illness, and, how to avoid the need for medications or how to get people off medications once they're on them, how to avoid the need for surgery. When we look specifically at heart disease, again, we have to go back to the 1950s and look at, when this war on heart disease was declared. And at that time, there were two competing theories about what the primary cause of heart disease was. And they were both dietary theories. We recognize that this is probably going to be related to the food that we're eating. And there were two schools of thought. One was that the fat, the saturated fat, the cholesterol in our diet was driving heart disease. And the other was that sugar in our diet and the increasing amount of sugar that was in our diet was causing heart disease, was the primary cause of heart disease. Now, for various reasons that aren't purely scientific, the fat theory won out, what we call the diet heart hypothesis. And that became the prevailing hypothesis about what causes heart disease.
Was that Ansel Keys or was that a separate?
Yeah, so Ansel Keys was the primary scientist kind of leading that movement, leading that, pushing that hypothesis. And Ansel Keys was a physiologist who, kind of came into the heart disease space because of the prominence of it and really took over. And he later became the head of the American Heart Association, and he put forth much of the science that this hypothesis was built upon. Now, we now know in retrospect that a lot of the science that Ansel Keys put forward was somewhere between poorly done and fraudulently done. Depends how you look at that story. But for instance, one of the seminal studies that the diet heart hypothesis is based upon is what was called the 7-country study. And in this study, Ansel Keys purported to show the relationship between dietary saturated fat and heart disease on a country by country basis. And he shows 7 countries and he shows a nice graph where they line up, more saturated fat equals more heart disease. What wasn't revealed in that paper was that Ansel Keys actually had data from 22 countries and he handpicked the 7 countries that lined up. But when you graph out all 22 countries, you see that there's no relationship between saturated fat intake and heart disease. And you see countries like France that had the highest intake of saturated fat at the time and one of the lowest incidence of heart disease. So that's how this hypothesis got started. And then, the system kind of took over, as systems tend to do. We put more and more effort, more and more money into this hypothesis. The drug companies got involved in lowering cholesterol levels, lowering blood cholesterol levels. The food industry got involved in taking fat out of our diets and creating low-fat foods. And the U.S. dietary guidelines came out, so the government got involved. And here we are now, as I said, 70 years later, 40 years since the introduction of the U.S. dietary guidelines, 30 years since cholesterol-lowering medications became the most commonly used medications in the world. And heart disease is still the number one killer. So a logical person is going to look at that and say, maybe we got something wrong in the hypothesis, but we're at a point now that the system is so bought into this hypothesis that it becomes difficult to even ask those questions.
There are a lot of great doctors out there, and I don't want to say anything that would go against that, but I want to kind of touch on how the potential dark side of this fraudulent research and how we're still seeing echoes of it generations later. Does that set up the potential for well-intentioned doctors to inadvertently inflict harm upon their patients? Is that what we're seeing?
Yeah, it certainly does. And, I now freely admit that, for the first part of my career, I was part of that, because I not only bought into the narrative about cholesterol causing heart disease, but I wasn't even aware of the alternative hypothesis, I'll say. The whole history of Ansel Keys, everything I just went through, the alternative theories about what might be causing heart disease, I never heard about in medical school in my training to become a heart surgeon. There was one thought only, it wasn't even a hypothesis. It wasn't even referred to as a hypothesis. It was dogma. Yeah. Cholesterol causes heart disease. And that's how I was trained. That's how I was educated. That's how all my colleagues thought. That's what everything I read in the textbooks and most, in the medical journals. And understand that doctors don't have the time to go through all the medical literature, because it turns out that there's a lot in there that contradicts this hypothesis. But that's not what gets put forward to us. By necessity, you can't teach everything, to doctors in medical school and in training. And so it's filtered. And the filter, by the time I came through medical school in the 1990s, certainly, was that cholesterol causes heart disease. No need to question it. It's proven fact. And all we need to do is then act upon those facts, lower people's cholesterol, with various means, dietary, pharma, or whatever. And that's going to be the best way to prevent heart disease.
I'm interested in the aha moment for you. So you've been trained. You went through medical school. You maybe you had student loans and all this debt or whatever, to pay for your education, and you're on your way to this career. At what point did you realize that it's something else that I need to be looking at? Was it your own health journey? And if so, was there a moment, or was that kind of gradual?
Yeah, so it really does tie back to my own personal journey, because what I found where I was I was a very unhealthy heart surgeon. I was morbidly obese. I was pre-diabetic, and I knew that I was going to end up on my own operating table, so to speak. I had all the risk factors. I had family history, and everything was pointing towards me developing heart disease and ending up on my operating table. And I started to think about, how can this be? I'm following the advice that I learned to give my patients, that I was educated on. It's not working for me. And, for the most part, it's not working for my patients. The people that end up on my operating table, yes, some of them just completely ignore their health. They smoke, they, eat all the foods we're told not to eat. They don't take their medication, and they end up on my table. But many of my patients were following the advice. They were eating their low-fat diet. They were taking their medications, and they still were ending up on my operating table. So I went on a personal journey. I ultimately was able to lose over 100 pounds once I heard about low carbohydrate diets. And my aha moment really came while I was at a medical meeting, hearing a journalist, Gary Taubes, talk. And Gary had just written at that time The Case Against Sugar, prior to that, he wrote, Good Calories, Bad Calories, and Why We Get Fat. And he was really the first time that I heard about, the types of food being more important than the amount of food that we're eating. And that low fat is probably not the right approach to overall health. And this led me down a pathway that ultimately got me to see the holes in the diet heart hypothesis, the cholesterol hypothesis, opened my eyes to what I was really seeing every day in front of me, which was, a lot of the patients that end up on my operating table don't have high cholesterol or are on medications to treat their high cholesterol, and they're still ending up on my operating table, and ultimately got me to the place where I could start asking those questions. And, for me as a physician, ethically, morally, once I was aware of this, I couldn't not talk about it. I couldn't not spread this information. And I had to find ways to help people. And that is what led me to, my mission to keep people off my operating table.
For a lot of people, the operating table, it seems like an unavoidable destination. I hear people when they talk about their heart doctor, and it's just so casual. Like, I've got to go in and get this done. So I guess my question is, from somebody that is as young and naive as I am, I haven't experienced a lot of these cardiovascular type issues yet. It does run in my family, and I try to take steps now that will set me up. But so my question is, can it truly be dodged? Can the operating table be dodged, and can lifestyle changes outmaneuver surgical interventions? And just one example from a friend that I want to kind of just get your input on would be mitral valve prolapse. Is that more of a physical issue, like an anatomical issue, or can something like that be affected by dietary interventions?
Yeah. So first we need to recognize that there are multiple forms of heart disease. And the primary form of heart disease that I'm talking about is what we call atherosclerotic heart disease. It's the most common form of heart disease. And it's what occurs when plaque builds up in the arteries of the heart, and we start to get blockages in the arteries of the heart. And the heart is a muscle, and the heart needs blood flow and oxygen to work properly. And when that blood flow starts to get reduced by these blockages, it leads to trouble like heart attacks or what we call angina. Other forms of heart disease, things like valvular heart disease that it sounds like your friend has, are less common, but still prominent. Now, when it comes to atherosclerotic heart disease, it is clear that dietary and lifestyle interventions can prevent the progression and prevent it from occurring in the first place. The issue becomes which dietary interventions, and of course, we've been talking about that, and we'll talk about it more. When it comes to other forms of heart disease, like valvular heart disease, it's less clear, but I still think that there can and will be a significant impact from these dietary interventions, because the overall heart function, is important as well. And the progression of valvular heart disease probably has a lot to do with inflammation as well, inflammation and damage that occurs to the valves themselves. And again, those things seem to have their roots in diet and lifestyle as well. So I would say not as clear for the valvular heart disease, but for atherosclerotic heart disease, which is by far the most common form of heart disease, definitely diet and lifestyle related.
Nutrition advice, it's always changing, and it's what one person says is healthy is definitely probably not healthy, and especially when I hear from doctors what they think is healthy. I don't want to give away your book, but in a nutshell, can you kind of give us your approach to dietary interventions? Is that a low carb approach, and do you practice keto or carnivore?
Sure thing. So, what I tried to do in the book was, again, kind of step back and answer the big questions, because I saw the same thing that you observed. You have vegans and you have carnivores, both telling you that this is the most healthy way to eat. How can this be? And you have everything in between: keto, Mediterranean, all of the low carb variations. And what I stepped back and said, well, what do all of these things have in common? And what we really find is that it ultimately processed food. And, these are the things that comes in boxes and bags. These are the foods that have long ingredient lists, much of which we don't know what those ingredients are. And they're not how food occurs in nature. They're not what food used to be. Again, recognize that up until, 100, 150 years ago, all the food that we ate was either grown in the ground or something that ate the things that grow in the ground. It was animals and it was plants and it was fruit. And when we were eating only that, we didn't have heart disease. We didn't have all of the chronic diseases that we struggle with today. Things like type 2 diabetes, Alzheimer's disease, many forms of cancer that, again, we see skyrocketing over the past 50 to 100 years. These things did not exist before processed food gets introduced. So I think the meta concept, that I want people to understand about nutrition and that I try and get through in the book is to eat whole, real food. Eat the things that grow in the ground and eat the things that eat the things that grow in the ground is kind of the simple rule I use. Now, there are a couple of different approaches that can be successful with that. For other reasons that we can get into, I think the low carbohydrate approaches are most easy for people to maintain, and I see the most success with. That's what I have done personally. And I, have kind of, I guess you could say, gone to the extreme of low carb, which is carnivore, eating primarily animal proteins. And again, I think there are some unique benefits to that approach, but I don't say that that's the right approach for everyone in every situation. And so I think we need to recognize that there is not one right diet for everyone. I purposely did not give you Dr. Ovadia's 28-day diet plan in the book. I go through a lot of these dietary strategies. I talk about what might be good about some of them, what might not be so good about some of them, and then up to each one of us individually to take charge of our health and to figure out what diet is going to work best for us.
Yeah, it's not a one size fits all approach. And in the end, these are all kind of tools, right? Carnivore is a great way to eliminate, a lot of these things that you may not even realize could be causing problems and kind of add them back in, sort of slowly. My dad was actually able to come off his blood pressure medication just recently following a carnivore diet, and has come way down. So I see that kind of, within my family, which is interesting. You did touch on something that I want to talk about, and that is, so you're a physician operating within the broader medical system. What freedom does somebody like you have to be able to, obviously you're doing it, but speak out in the way that you are, and how is that looked on by the rest of practicing physicians and surgeons? Do you stand out in that school of thought?
Yeah, I certainly do, and especially among heart surgeons, I am one of the few who speaks out about these things and, questions the mainstream narrative. As within any system, someone who is kind of going against the dogma is going to get some pushback. And we, looking at sort of the larger societal issues, questioning dogma has become quite problematic for many people. I am fortunately in a position where I have been able to sort of craft my career in such a way that it's given me some latitude. And, I haven't gotten direct pushback, but I get attacked on social media a lot. A lot of my colleagues in the hospital, kind of think I'm the crazy one for talking about these things. But again, I ask them to kind of wake up and look around them. Any physician practicing today, I think, should be looking around them and saying, why are there so many sick people? The healthcare system is overwhelmed. And this was the case before the pandemic came along, but it became, glaringly obvious during the pandemic. The healthcare system is overwhelmed taking care of sick people. And we talk about shortage of, doctors and nurses and hospital staff. And we talk about the economics of being able to afford our healthcare, again, here in the US and worldwide. And instead of saying, well, how can we deliver it cheaper? How can we get more doctors? How can we get more nurses? We should be stepping back and saying, why are there so many sick people? Again, this isn't how it always was. You go back to the 1900s, you look at ancestral populations that are still around today, and they're healthy until they die, pretty much. They don't go through long periods of their life where they're sick. And the expectation, the norm here now is that you're going to spend the last third to half of your life sick on medications, requiring hospitalizations, requiring surgeries. And we should be asking why that is, because it's not how it needs to be.
And I totally agree with that. And I wish there was something that I could do, at least with the people that I know in my own lives. But it's doing this podcast and things like that, and speaking to those that are counter to what the mainstream narrative is. That it helps kind of gives me purpose and I find momentum with it. But I wanted to kind of shift gears here, and it's something that we've talked about in private messages with each other, this artificial intelligence and how it's being implemented. And I'm curious, I like to talk with people in each of their fields because everybody is using it differently. But I'm wondering how you see it influencing your field, and if it could potentially enhance a physician's or a surgeon's diagnostic ability, or if it could just further exasperate what we see already with these diagnostic guidelines that seem to be perpetuating heart disease in itself.
Yeah, so I think, like all of society, it's going to have a major impact on medicine. And there probably are multiple pathways that can take, both good and maybe not so good. One of the issues that physicians have, and, practitioners of all sort have, is there is just a overwhelming sea of data around us. When we look at a patient and we think about all the data that we can get from that patient, with various monitors and lab tests and, all of the things that we have available to us today, the problem becomes which of that data is relevant? How do we filter through it? How do we recognize the important points, the signal in the noise, so to speak. And I think that's a place where AI, may be a great help to us. I think AI can also, be a good assistant in medicine as an assistant. Some of the sort of mundane tasks that are part of taking care of people, documenting and things like this, practitioner communication. A lot of that, AI seems to have a lot of potential for offloading and making easier. The problem becomes, first of all, what are we going to be training the AI on? When we look at something like heart disease, if the baseline assumption in what you train the AI is that cholesterol causes heart disease, and we need to be looking at, how cholesterol causes heart disease, that's going to lead us further down this same pathway that we've been down. But I'm also optimistic that AI can cut through this. It can see the true data, and, the AI will start saying, well, how can cholesterol cause heart disease if half of the patients that end up on the operating table don't have high cholesterol? Yeah. You can't hide that data from AI.
Hopefully if it hits, fields of specialty like yours, that by the time it does, that there are multiple options for different AI models, so that you don't just get a model that's trained on the Dr. Allos of the world and the American Heart Association and stuff like that, because then you're going to get a very specific type of narrative.
Exactly.
What we're seeing now with AI, there's all these different type of models. I just interviewed the founder of Freedom GPT, and it's an AI model that stands alone on your computer, doesn't require the internet, and is not censored. So you can ask it all these questions that you get completely different answers on something like OpenAI, and it's really interesting. Like you could train like a standalone model yourself on like a data set that's very specific to low carb, cardiovascular science, or whatever. A sort of a lighthearted question. Presidential race coming up, and we're seeing some people start approaching some of these topics. And one of the topics that is kind of entered the conservative side is why are we seeing all of these rise of inflammatory disease, autoimmune, cardiovascular issues, gastrointestinal issues over the last 50 years? I have some hypothesis on that, potentially like things like glyphosate and plastics and bisphenol A, BPA, and stuff like that. If you were to enter the presidential race, hypothetically, what would you do? What is one action that you could take that would have downstream effects that would solve a lot of these issues that we're seeing with metabolic health? Or is that even possible?
Yeah. So, I think we need to start with a reexamination of the U.S. dietary guidelines. And we need to do that in a way that is not subject to the regulatory capture that our current U.S. dietary guidelines are. So currently, the U.S. Dietary Guidelines Committee is made up of people with very tight ties to both the food and the pharmaceutical industry. And we need to get them out of this process, and we need to go back to the true science of this process. And, I think that is sort of that will have the downstream effects that we're looking for, because the U.S. dietary guidelines now, not only in the U.S., but worldwide, dictate what food gets presented to people, what food gets produced, and, where the subsidies are within the food system, all of the incentives. And, it still stands as a recognized advice, and people think it's, that advice is based on science. And again, when we go back to the beginning of that process, the McGovern Committee, which was the congressional committee that ultimately led to the U.S. dietary guidelines, the senators on that committee, as they were going through the hearings, basically admitted that we didn't have the science that we need to make dietary recommendations, but it was felt to be such a crisis that they said, we can't wait for the science, and we just need to make recommendations to people. And then, as that committee went through its growth, through its cycles, it just became more and more entrenched with both the food and the pharmaceutical industries. And so now we're at a point where they blatantly ignore the science. Nina Teichels has been leading the Nutrition Network. She has been advocating for consideration of low carbohydrate diets by the U.S. dietary guidelines. And in both of the last two cycles, so now we're over a 10-year period because they do this every 5 years, they have just ignored it. They have said, we can't find science on low carbohydrate diets. And, the Nutrition Network and Nina presented them with 82 studies on low carbohydrate diets, high quality studies done on low carbohydrate diets, and they just flat out ignored them. And they just went back to their position of there isn't any science on low carbohydrate diets, so we're not even going to consider whether they might be a valid dietary option.
And I've made this comment before that these regulatory bodies, they're prostitutes for regulatory capture by corporate interests. And even the people that are setting the guidelines now for 2023, I think that 70% of them have ties to the pharmaceutical industries. Senator Grassley has sent them a demand letter telling them to resolve these conflicts before they proceed past this week. So I'm really interested to see how that unfolds. One in particular, I can't remember her name, but she receives checks from basically Norvodisk that makes Ozempic, right? So, and these are the people that are setting our dietary guidelines.
Yeah, exactly. And, we see this pervasive throughout the healthcare system. The healthcare system itself has been captured largely by the pharmaceutical industry. And at this point, it actually becomes very hard to separate the food industry from the pharmaceutical industry. there's a lot of intermingling there, and basically they're supporting each other. And they are involved in everything. They're heavily involved in the funding of medical education. And again, that's pretty problematic for the funding of medical education to be coming from the pharmaceutical industry. But it's pervasive and it's baked into the healthcare system these days. And if we're really going to have impact on this, we need to start separating these things. Obviously, very challenging to do. But it's going to be necessary.
Go ahead, Doc.
I was just going to say, when we look at the big picture, we're literally collapsing under our own weight and the disease that comes with that weight. So we need to start tackling this problem. And I am encouraged to see that it's starting to become a subject of presidential campaigns, because it needs to be. It really is the most pressing problem facing our society today. If we continue down this pathway and we continue to get sicker and sicker, it leads us to a point where we just can't have a society anymore. We can't afford to take care of all these sick people. So I believe it should be first and foremost in, the presidential campaigns.
What do you recommend to people who are currently in the cycle of going back and forth with their heart doctors? Is there a certain couple of questions that they should ask? Like, if they're stuck in the current paradigm of medicine 1.0?
Yeah. So the first thing I think people need to do is to take charge of their health. They need to recognize that you are in charge of your health. Your doctor is there to guide you and assist you, but he or she is not the one that's going to make you healthy. The healthcare system isn't there to make you healthy, like we've been talking about. It's there to take care of you when you get sick. So we each individually need to take charge of our health. We can be empowered to take charge of our health. And that needs to start with diet and lifestyle. The food that we eat is the most important input that we give our body. And if something's not working properly in our body, we should be looking first and foremost at the food that we're eating. So if you've been seeing your doctor, you've been seeing a heart doctor, and they haven't even mentioned to you, what we should be eating, they haven't asked you what you eat, that should be a big red flag at this point. And, when you're having the conversation with your physicians about medications, and this goes beyond heart disease, the question should be, why do I need this medication? And is there a way for me to get off it? And again, that's not a question that doctors tend to talk about. We just think we put patients on the medication and we have to adjust dosages. Maybe we have to switch medication, but pretty much they're going to be on that medication because the medication is the treatment for the problem. And realize that most medications don't reverse the problem. They don't fix the problem. For chronic care, acutely, they do. If you have an infection, take an antibiotic, infection is gone. It did what it's supposed to do, and you get off of that antibiotic. But if you have high blood pressure and you're started on medication for high blood pressure, it doesn't make the high blood pressure go away. It covers up the symptoms. It lowers your blood pressure, but you stop taking the medication, you're going to get your high blood pressure again. So we need to be asking, what can I do to reverse that high blood pressure? Like you mentioned with your dad, it is possible. I see patients all the time now that get off of medications for things like high blood pressure and type 2 diabetes when they change their diet and lifestyle.
And you say it in your book, the medical establishment, what they say, well-intentioned doctors in the system, they'll say these things happen, next patient, right? After they're on the operating table. And I'll just leave it with that, Doc, because you've really jammed a lot of value into this conversation. So I just want to thank everybody for tuning into this episode. I hope you enjoyed our conversation with Dr. Ovadia and gained some valuable insights into metabolic health, maybe the things that are driving it, obesity, hypertension, and their effects on heart health, and how there is a paradigm of medicine 1.0 and 2.0, and asking the right questions with your doctor will help you navigate that. And it's never too late to take control of your health, make positive changes in your life. And if you want to know more, you can pick up a copy of Stay Off My Operating Table by Dr. Ovadia on Amazon. You can follow him on Twitter at iFixHearts, and he puts out content on YouTube. There's even a new reversed carnivore keto kind of TV show that he was involved in. And if you would, please don't forget to subscribe, rate, and review Motivated Endeavors podcast on your favorite platform. Thank you for supporting us on this journey, and I hope you find what you need in overcoming your challenges and achieve success in your personal and professional lives. Until then, stay motivated and keep striving for greatness. Thank you, Dr. Ovadia.
Thank you, James.